Welcome. Fantastic to see you all here today for our special session on spirituality and mental health. My name's Ilse Hampton. I'm the CEO of Meaningful Aging Australia. As we begin, let's acknowledge the traditional owners of the lands where we are. You might like to put the traditional owners of the land where you are into the chat. For me, here in the northern suburbs of Melbourne, it's Wurundjeri people of the Kulin Nation. Pay my respects to elders past, present and emerging. And at Meaningful Aging Australia, as many of you know, we really honour the spiritual strength of Australia's First Peoples. We also honour any traditional owners that are with us today. Special welcome as well to Jennifer Greenham from Spiritual Health Association, who's our guest presenter today. And I have in the team, Jackie and Monique in the Meaningful Aging virtual office, beaming from you. Really could be anywhere on the planet, I guess, but actually they're in Sydney and Melbourne. So spirituality and mental health are two topics that I just feel are absolutely paired. Indeed, I can't imagine how we could separate them. And of course, during the experience of the pandemic, this is something that's become more and more apparent for more and more people as we've been forced into examining those parts of our lives that maybe we've been avoiding or not having space for. So I'm really excited to have Jenny with us today. She's an expert in this area and is from our kind of sister organisation, our good friends at Spiritual Health Association. I'll hand over to you, Jenny. Thanks for joining us.
Good afternoon, Ilse, and good afternoon, everybody. Thank you for inviting me along. It is a privilege to spend these few minutes with you today. I too acknowledge the traditional owners, and I also like to acknowledge anyone in the audience with a lived experience of mental ill health. So as Ilse says, there's never been a better time to talk about mental health and spirituality. So I thought today I'd break up the presentation and there are no slides today. It's just a little fireside chat with a lunchtime chat with you all. Presentation into two parts. A little bit about mental health and spirituality in the context of a pandemic. And I am located in Melbourne, Victoria. So the experience of lockdown, the extended lockdown scenario offers a range of insights into the conversation. But I appreciate the guests, you people are coming from all different parts of Australia. So your experience might be different to some of ours. And then I'll move into the broader view of the professional mental health and spiritual care space. So yes, the pandemic experience has enabled us all to get in touch with a range of feelings ranging from fear, loneliness, isolation, anxiety, depression, vulnerability, fragility, uncertainty, and many, many others. And for many of us, many of these experiences may have been largely unfamiliar until now. But these experiences can very easily merge into mental health systems if we don't have good supports in our life, or we don't have a solid base or foundation of who we are and how we are in life. So the prevailing commentary of many mental health professionals and leaders in the field over the last 18 months has suggested that the collective experience of the pandemic has actually had a positive impact in the sense that it has helped to destigmatise mental health and mental illness in the community. Because what has been previously, pushed under the carpet to a certain degree, or, mental health has always been regarded as a little bit of a poor relation to general health. And definitely in the way that it's received funding. So the collective pandemic experiences help to shine a light on some of these collective experiences destigmatise it, and so in a funny sort of a way, the pandemic has elevated mental health into the spotlight because of the vulnerability that we've all, to some sort of an extent, lesser or greater, have experienced. So equally, the pandemic has created fertile ground for people to explore aspects of themselves which they may have been previously neglecting, ignoring, or avoiding, and that is their spirituality and inner life. So as our world, for many of us, as our world has decreased and got a lot smaller because our external lives have been put on hold, how we are with ourselves and how the resources we draw upon become really, really important. And for many others that have strong spiritual practices in their life, this has been an opportunity to go deeper with them and feel even more solid in who they are and how they interpret the world around them. So everyone I speak to, it's like the pandemic has a different touch point for them. It affects everybody in a slightly different way, a different angle, but commonly it comes back to either an emotional response, psychological, social, definitely social implications. But for many, so many, it's pushed those spiritual and existential buttons, and then at the end of the line has impacted somewhere along the line to our mental health. In my role, I get to meet and work with people with a lived experience of mental ill health, and they inform my work to a great degree around the intersection of, on the importance of spirituality for them. And in talking to them, many of them have indicated that actually nothing much changed in their life through the experience of the pandemic. So what they were saying to me is that their lived experience of mental ill health has actually equipped them really well to deal with constant fear, anxiety, isolation, depression, loneliness, some of the things that the rest of the population are coming to terms with. People with a lived experience of mental ill health, this is their everyday reality. And to me, that felt very salutary and very humbling for the rest of us to take notice. And this is where the intersection of mental health and spiritual health actually rub. This is where they come together and where there actually is not any great separation. So the strength of our inner connection actually correlates to our capacity to stay steady in the face of constant change and uncertainty. So it's natural that the spotlight comes down onto our spirituality. Our spiritual practices and our spiritual resources become so, so important. So I'd be interested to hear, perhaps in the chat section, how you've been adapting or modifying the ways that you have been spiritually nourishing yourselves. And I appreciate there's a range of experiences in terms of whether your lives have been impacted by a lockdown or not. But I think the general pandemic experience it has impacted all of us in some way or another. So now to the professional mental health and spiritual care sector space. Through the magic of the lives that we're sort of living now and our capacity to jump online and join in lots of different events that we wouldn't have had any scope to previously. In the early hours of yesterday morning, I joined in a Science of Spirituality symposium that was coming from Brazil. A bunch of mental health clinicians talking about the space of spirituality in mental health care. And it was titled, where are we and what lies ahead in the mental health and spirituality space. So there's a couple of gentlemen, Harold Koenig and Ken Pargament, who are leading lights in the research arena for 30 plus years now. And they were speaking into this space yesterday. And some of their key messages were that the research has consistently illustrates that spirituality plays a positive role in mental health presentations such as depression, anxiety, substance abuse issues, and it is indeed a protective factor against suicidality. But we note that, you know, spirituality hasn't always been warmly embraced by the medical model. So, and why is this so? So they were offering up a couple of reasons. The first one was that there is no universally accepted and agreed upon definition of spirituality. And I certainly know that, and my colleagues at Meaningful Aging would be aware of that as well. Also, spirituality is a lot about relationship, how we are in relationship to each other and ourselves. So the causality of relationship, the what influences what factors aren't so easily determined, because spirituality is a complex, dynamic and evolving domain of our personal expression. So quantifying that hasn't always been straightforward or easy. And in that sense, any field of inquiry needs to be able to tolerate ambiguity. And the medical model just isn't very good at ambiguity in my experience. But our research, the research practice in the mental health spiritual care domain is improving. And what these gentlemen were asserting is that we have only seen the very tip of the iceberg of how spirituality positively impacts health and mental health outcomes. And they feel like we're coming into a period of maturity in the way that we're collecting data, reporting on how to integrate spirituality into practice. And they're suggesting that we're actually moving into the applied science arena. So in other words, spirituality is finally commanding its rightful place in the evidence-based practice world. That's really, really heartening. Another thing that I was reflecting on in thinking about what I'd talk to you about today is one of the main training modalities for work in the spiritual care sector is the clinical pastoral education model of training, also known as CPE. And it was developed by a fellow by the name of Anton Boyson early last century, who he himself had an experience of ill mental health. And he created the action reflection practice model of care. And he famously coined the human living document, which really supports this exploration and dynamic space of the whole person and whole person-centered care. So in that way, there's a beautiful, really beautiful and tangible historic connection in the mental health and spiritual health spaces. There's also another historic connection in the evolution of the recovery model of care, which is universally adopted across Australia in all mental health practice models. And that too has its origins and connection to spirituality and spiritual care values. And this dates back to the 1970s in the States, where a group of mental health patients started to push back against some of the cold clinical treatment that was coming at them. And they were saying, hang on a minute, you're not seeing me, you're not hearing me. I need you to relate to me in ways that are important to me. The treatment that you're offering needs to offer hope, meaning, purpose and connection. And I need to feel empowered with what works for me and what resonates for me and what celebrates my lived experience. So you can see there very clearly this crossover of spiritual care values and what have now become recovery model principles in the mental health space. So moving along to more recent times, the World Psychiatric Association developed a position statement called Spirituality and Religion in Psychiatry. So that felt like a pretty exciting move and a nod from some fairly influential friends. And locally here, the Royal Australian New Zealand College of Psychiatry released a position statement in 2018 called The Relevance of Religion and Spirituality to the Practice of Psychiatry. So in principle, there is this greater recognition of and uptake of the role of spirituality in how we can support people in the mental health sense. Yes, there is a growing body of really solid evidence out there, and I wanted to bring to your attention the result of a really great qualitative study done in the UK a couple of years ago, actually a systematic review. And out of this review has come what is known as a Mystic Toolkit or Mystic Resources. And I thought for those of you who are interested, I will put together a small package of further reading and these Mystic resources to help with your exploration and inquiry. So maybe they can be posted out via Ilse and Jackie at Meaningful Aging. But the Mystic in particular is a great supportive tool for encouraging exploratory conversations with people and helping to break down the barriers to conversation, because noting that many of our mental health colleagues, many of our general health colleagues in their healthcare education and training, spirituality was just not included at all. So whilst many want to integrate spirituality into their healthcare practice, they just don't know how. And you will be aware of that. And Meaningful Aging have developed some fantastic resources to support practitioners as well. But these ones are specifically designed for the mental health space, so I can pass those along. Here in Victoria, we've recently a Royal Commission into mental health service delivery, alongside a very big, large national reform agenda in the mental health space. And all of those movements are working towards a much more compassionate, caring, person-centered care model. So that bodes well for us in the spiritual care space and those of us who are interested in promoting spirituality as part of the work we do. Just as I finish up, I'll bring to your attention, this is a resource from Spiritual Health Association. It's probably can't see it very well. It's called Heart and Soul Matters, a guide for providing spiritual care in mental health settings. It's currently at the printers getting an updated print, and a new PDF will also, downloadable PDF will be available on our website shortly. So keep an eye out how you can download that or purchase hard copies. And earlier this year, myself and my team developed this little resource known as the Small Gift. It's a supportive tool for for all healthcare professionals to support their spiritual health and mental health by exploring some deeper questions. The follow-up, the next iteration of this little resource is called the Little Book of Spiritual Health, which is due for release mid next month. So again, stay close by to our website and you will see our updates there. So that's a very quick run through some of the areas that I work across, and thank you for your attention, and I look forward to some questions, feedback, comment. Thank you, Ilse.